Hello, I'm Associate Professor Michael Woodward, and I want to talk about the role of a medical food, Souvenaid, in the management of patients with mild cognitive impairment. We have about 420,000 Australians with dementia, most commonly Alzheimer's, but about another 1 million people with mild cognitive impairment. And people with mild cognitive impairment progress to dementia about 3 times faster than those who don't have mild cognitive impairment. About 1 out of every 3 people with mild cognitive impairment will develop dementia due to Alzheimer's disease within 5 years. It is not normal aging, and because of our aging population, general practitioners need to be good at both the recognition, the diagnosis and management of mild cognitive impairment. Now, what happens in this process is that synapses are damaged by amyloid and tau proteins, and there's a direct link between the synaptic loss and the amount of memory that we lose. Loss of synapses leads to loss of memory and indeed loss of function and loss of brain volume. Synapses are built from membranes, and the production of synaptic membrane comes from a pathway called the Kennedy pathway, which requires uridine, choline, omega-3 fatty acids, polyunsaturated fatty acids, and some other micronutrients. This leads to new neuronal membrane production. And there's a higher nutrient need if the synapses are being damaged by the toxic proteins amyloid and tau. Unfortunately, however, in those who are suffering from the development of Alzheimer's disease, there's a lower intake of these nutrients and there's compromised endogenous synthesis, which leads to lower levels in the blood and lower levels in the brain. We can overcome this, however, with Souvenaid, which has the nutritional precursors and cofactors for synaptic formation. The evidence for its efficacy comes from the 36-month Lipidi Diet multi-nutrient clinical trial, which was funded by the European Commission, randomised, double-blind control. The patients were between 55 and 85 and had mild cognitive impairment due to Alzheimer's at the beginning. The 311 patients were randomised into 2 equal groups, and I'm going to give you data both at 2 years and out at 3 years. There was considerable attrition, as you'd always expect in a trial of older people with cognitive impairment, but the groups remained fairly evenly balanced. And we're going to look at cognition, function, and brain volume. The primary endpoint was the neuropsychiatric test battery 5-item composite score, and there was a significant difference between the placebo and the Souvenaid arms at 36 months, with a slope reduction of 60% less, 60% slower deterioration in those on Souvenaid. And a subscale, the memory subscale of the NTB, also showed a significant improvement or less decline in those on Souvenaid, with a slope reduction of 76%. Another composite score is the Clinical Dementia Rating Scale, sum of boxes, and this showed a 45% slower decline in those on Souvenaid compared to placebo, and this was more so in those who had a higher MMSE at baseline. In other words, the earlier you start, as long as you've already got mild cognitive impairment, the earlier you start, the more likely you are to have a greater benefit. I mentioned brain volume. Well, interestingly, the hippocampal volume deteriorated 33% more slowly in those on Souvenaid compared to those on placebo. And there's very good evidence now that brain atrophy links with synaptic loss and with the clinical manifestations of neurodegenerative diseases such as Alzheimer's. However, it can be challenging to assess the meaningfulness of these slope reductions in mild cognitive impairment due to Alzheimer's disease. And a metric that's more easily understood needs to be developed. And the one that we can use is called the time component test. And this looks at the difference in slope and converts this into time saved. And this is the way we do it. We have A, the decline in patients experiencing after a certain time when on the intervention, in this case Souvenaid, and we also have the other line, which is the decline in those who are on the placebo. And the time saved is the difference between the 2 time points in these slopes. Converting that into more easily understood numbers, in this study, it showed that when we combine the different rates of slope decline for those with in the neuropsychiatric test battery, in the CDR sum of boxes, and in hippocampal volume, we end up with approximately 9 months saved after 24 months of intervention, Souvenaid compared to placebo. Now, there are some nationally informed recommendations on approaching the detection, assessment and management of mild cognitive impairment. This is an Australian production, and if you look at the QR code there, you'll see the infographics that can help you apply this intervention to your patients. But it also talks about detection and diagnosis, sharing the diagnosis, monitoring and follow-up, and personalising care. In terms of the interventions, we need to look for the risk factors that apply to our patients and then mitigate those risk factors. So, for instance, we should be deprescribing medications that might impair cognition. We should manage cardiovascular risks such as blood pressure and cholesterol, evaluate for depressed mood, evaluate for hearing impairment, and indeed address these. Screen for sleep disorders, make sure the person's not excessively drinking and not smoking. And we need to reduce access to, reduce air pollution exposure if we can. Now, in terms of lifestyle interventions that are covered in this Australian publication, we recommend physical activity, nutrition, which should be as close as possible to the Mediterranean diet, Souvenaid, cognitive activity, social connection, and mindfulness. And we should be encouraging patients with mild cognitive impairment to undertake these lifestyle and nutritional interventions. So in conclusion, results from the Lipidi Diet randomised control trial in mild cognitive impairment show that Souvenaid, compared to placebo, slowed memory and cognitive decline, slowed cognition and functional decline, and slowed the rate of hippocampal atrophy all over 3 years. So Souvenaid, also known as Fortisine Connect, slows disease progression by 9 months when taken for 2 years in people with mild cognitive impairment due to Alzheimer's. Recent nationally informed mild cognitive impairment recommendations state that patients with mild cognitive impairment should be informed of this result from the Lipidi Diet study and the availability of Souvenaid in Australia. All studies show that Souvenaid is well tolerated and has a positive safety profile, and it can be used alongside current medications, and it is suitable for use. In fact, it is encouraged for use in the earliest stages of the disease. Thank you.